Okay, so we're going to go ahead and get started. And we know that there are going to be some more people coming on in a minute or two. So they'll come in at the very beginning. So first of all, thanks everyone for logging in to our grand rounds today. We are honored to have Ms. Alicia Johnson, who is the Executive Director of Step Up Savannah. What she's going to speak to us today is the topic of powering a more economically inclusive community. And as you know, for us in public health, these are the type of issues that are always a big concern to us. So I know there's a little bit more about Ms. Johnson, and I'm going to turn it over to her and let her introduce herself a little bit more, and then we will take it from there. So Ms. Johnson, the floor is yours.
Good morning, afternoon, everyone. I'm glad that you were able to join this conversation today. It's a very important conversation, and I'm excited about having the opportunity to share with you and to learn with you. It's very important for us here at Step Up Savannah to help inform our community narratives and provide context for each of you who live, work, and play in our community, and who will be doing the important work of not only adding value, but working in our community to drive change and to create opportunities for others. So thank you so much for joining this afternoon, and I am going to start and share my screen. So if hosting can be made available, we'll get right into it. I hope you can now see my screen.
Yes, we can.
All right. Okay. So let's talk a little bit about what Step Up Savannah is. Step Up Savannah is a local nonprofit, but originally, and it is different in the context of it was created by the city of Savannah and under Dr. Otis Johnson's mayorship. And it has survived from 2005 to date. It was created as a sectorial partnership in that this organization has working agreements with both the city and county to address specific quality of life indicators and to work toward poverty reduction. We've since advanced our mission into economic inclusion and financial security as we have learned and evolved. We want to make sure that we are staying ahead of not just the times and the economy, but also that we're following research-based best practice. Our mission here is to promote economic inclusion and financial security. And we believe that Savannah is a community where all people have hope and opportunity, where we can challenge injustice, and where all of our community members work together to create a more economically inclusive community. And so when we talk about economic inclusion, it is very much built on the concept of DEI. And I know that the acronym DEI now is trending very much in our social services, among our corporate America, and in our world right now. But when we talk about DEI, it should not be something that we're adding to our work. DEI should be about the work that we're doing, right? First of all, diversity is an advantage. It's including people, and not just of different races or genders, but of different abilities, experiences, orientations, and identities, because it helps us expand our perspective on things. So first of all, we should have a paradigm that diversity is an advantage. Secondly, when we talk about equity, equity is a right, and it's not based solely on a moral imperative. No, equity acknowledges that disparities exist in our society because of decades and hundreds of years of policy, practice, and programming that excluded and exploited certain groups of individuals. As a matter of fact, it was just in the 70s that women couldn't even fill out a credit card application without a man on it. So equity not only acknowledges that these disparities existed, and they caused exclusion and exploitation on purpose, but that it seeks to remove those disparities in opportunities, power, and resources so that everyone can reach their full potential to thrive in our communities. So when we are beginning to talk about resilience and building socioeconomic resilience, again, it's not simply a moral imperative. It is an act of justice that happened. When we talk about inclusion, inclusion is a best practice, and it really should be woven into everything we're doing. It should be a part of our core values. It should be in our practice, our policy, and therefore our programming, ensuring that opportunities and resources are available to people who might otherwise be excluded or marginalized. And we see this every day. If we think about what we take for granted, such as our ADA policies and laws today, just think that several years ago, just a few decades ago, it wasn't even thought about to have handicap parking or accessible buildings, or so that otherly or differently abled people would have access to them. So as we talk about socioeconomic resilience, again, it should be rooted in a core value of diversity, equity, and inclusion that understands it to be not just a moral imperative, but a economic justice imperative. And when we think about poverty from this grand place, or from this new place of that paradigm shift, we should be thinking about it in a way that dismantles the notion of toxic charity and deservedness, and replacing it with a framework of building socioeconomic resilience for our communities across Georgia. The Federal Reserve actually estimates that when people who live in asset poverty, which we're going to talk about in just a few moments, are not attached to their local economies, the economy actually loses trillions of dollars annually, and over 1.3% of our GDP annually. So it not only costs poor people more to be poor, it costs all of us to be poor, for poor people to remain poor. And we're leaving trillions of dollars on the table because families are not excluded from their potential to thrive in our current economic system. And so as we talk about resilience, and I'm sure you've heard this term before, but resilience is the ability of a system, a community, or a society, an individual that are exposed to hazards, that they have the wherewithal, the tools in their toolkit to be able to survive that, to be exposed to risk, and then be able to bounce back. So when we think about socioeconomic resilience, it really refers to the interaction, that same concept, but the interaction between all of the social and economic habits and of people, but the vulnerabilities that exist because of poverty and the socioeconomic conditions that are induced by poverty, by disability, by age, by gender, and all of those things that exist in our society. And so as we begin to talk about socioeconomic resilience, we can't talk about what that means without understanding what economic mobility is. Essentially, Economic mobility is simply the ability of someone to change their income or their wealth over their lifetime. And it's usually measured in income. And it includes the opportunity for children born into poverty to have the chance to break out of it and to change the generational trajectory of their family. Now, we know, based on the research and social science, that the primary predictors of economic mobility include education, location, and criminal background. We also know that based on those primary predictors, that children of color or BIPOC households are most impacted by these primary predictors from long-term social and civic and economic policies that have literally excluded them from building generational wealth and taking advantage of opportunity. And so when we began to talk about this, one of the first questions people say is, hey, we don't have slavery or Jim Crow anymore. And so everybody has equal opportunity to succeed. Well, the reality is that is not a factual statement, because what happened is those policies of redlining and Jim Crow have been institutionalized, and that they created impacts. And those things have not been rescinded or rolled back. And we today still have and are able to, from a social science perspective, and even from a public health perspective, we are able to forecast and predict someone's economic mobility, their health, and just by their race and where they live. Here in Savannah, I'm going to talk a lot about the data here in Savannah so that you can really connect to it. But when we think about that and we think about the economic mobility of our communities, we have to think about the children growing up in our community and where they'll be at in the next 2 to 3 decades. And so when we look at children who are growing up in census tracts that have been marked out by our federal government as opportunity zones because of income or asset poverty in those communities, we can see that the children who are currently growing up there are projected to make less than $25,000 by the time they are 35. Now, why do you think we're able to make those predictions about the lack of economic mobility if those exclusionary practices and policies and programs were still not impacting that, and we could use, we wouldn't be able to use those categories to predict their economic mobility or these particular indicators? The other thing that we should note is that all of these opportunity zones, if we were in our community to take a red line map from 1929 and lay it over our current city structure, the zip codes that were excluded and exploited and where people of color were forced to live, were not able to purchase property, and all of those things that happened during redlining, those are the same neighborhoods and zip codes that are being impacted today by a lack of socioeconomic resilience and are experiencing both asset and income poverty. When we think about just how much it costs to live in our community, we know that a household with no children here to live here, just to cover basic annual expenses before taxes, that person would need to make $37,000, a minimum of $37,315. Well, once you begin adding children into that household, you can see that that increases exponentially, and why the cost of living alone really excludes people from the economy here. So when we think about poverty, I want you to expand your definition, because poverty is not just then the absence of material wealth, but it is also the scarcity of access. It's the scarcity of influence, opportunity, education, and justice. And until we begin to expand, use this expanded paradigm, we cannot create interventions for socioeconomic resilience, because we will not be addressing this problem of exclusion and exploitation in our community in a way that removes barriers for people to thrive. I love what Nelson Mandela says. He says that poverty is not an accident. Like slavery and apartheid, it's man-made and it can be removed by the actions of human beings. And so what that does is it empowers you and I to not only have these conversations, but to move and have a call to action. And so how we define poverty will determine what we're willing to see about it, think about it. It will drive our motivation to resolve it, our commitment to resolution, what we're willing to give up. Because there are some in our communities who think there's only so much of the pie to go around, when in actuality, that's not true at all. We're losing because our families are not thriving. How we define poverty will also determine who we're willing to confront about it. Are we willing to confront legislatures and those who, because we're not going to be able to program our way out of poverty. We need some significant policy changes. And so, what we teach in our schools, how we respond to it at the local level, but also at the regional, state, and national levels. And finally, how we define poverty for ourselves and socioeconomic resilience will also determine what our personal leadership legacy will be. So poverty is a huge issue. It's a big issue, and it's a socioeconomic issue that has many dimensions. It includes race, gender, geography, certainly policy, and definitely wealth distribution. And all of those things, again, are facts. We are not talking about a political view. We are not describing a philosophy. All of these things that I'm sharing with you are facts that you can definitely do the research and look up yourself. And so when we begin to talk about poverty, we've got to understand it, and we've got to eat that elephant in chunks. And so when we talk about socioeconomic resilience, one of the ways, again, that Step Up focuses on it is around economic inclusion. And so what economic inclusion does is opens opportunities, right, for those in asset poverty to escape that cycle of poverty, and to utilize programs and coordinated interventions that seek to boost those assets and incomes. And EI also looks around and scans the community and works to eliminate poverty traps, which are mechanisms that make it difficult for people to escape poverty. Here in Savannah, for example, and we'll talk about this in a few more slides, we don't even have countywide transit. And so that literally landlocks those neighborhoods and those people into poverty who don't have a car and who can't get to a job, who can't go to a grocery store, who can't get to a bank. And so what we have is not only food deserts, we have actually food apartheid. We have banking deserts, and we have economic deserts, because people can't even get to work to get to a better job, to even improve their life, because of our lack of transportation in our community. So as we talk about asset and income poverty, I want you to distinguish between the two, because income poverty is typically what you see on a census, and it's the federal threshold. But when we talk about asset poverty, that expands the definition, because asset poverty really measures our net worth, and it's what the bank will look at to give you credit to buy a home or any of those things. So asset poverty is having insufficient net worth, and that includes durable assets such as a savings or a home or a business to be able to cover 3 months of living expenses without income. And when someone is asset poor, they literally have a net worth of 0. So let's consider this, that 78% of full-time workers say they live paycheck to paycheck. So that's increasing the bucket a lot. When we think about millennials, 4 out in 10 millennials are currently overwhelmed by debt, and that includes student loan debt, and are unable to save for retirement. And so that expands our definition of our community, who our neighbors are, and what that looks like on a larger scale. So when we look at Savannah's impoverished, Savannah's asset poverty rate is 35.6%. But when you drill down and look at asset poverty households of color, 43.5%, that number jumps to 43.5%. And it's primarily a Black household issue, when we have a small, about 2.6% population of Latinos here who make up those other percentages. The county's asset poverty rate is almost 31%. So even when we expand from Savannah into Chatham, we still see that we have a significant asset poverty rate. That's over a third of our community is living in asset poverty, even though we're the 3rd largest port in the nation and trillions of dollars are pouring in to our community. 31% of our population is underbanked or unbanked. 60% of our renters are spending 30% or more of their income on housing, and almost 55% of those who live at that federal poverty level, meaning their income, they're living at income poverty level, they're uninsured. So Savannah has a significant poverty issue. And again, as I mentioned earlier, the income poverty rate for African Americans in Savannah is 26.1% as compared to their white counterparts of 7.2%. And national studies and assessments have been done here in our city by national consultants. And what they found was, on average, all of those opportunity zones, all of those places that were redlined, all of those neighborhoods that have been excluded, where the port and the train stations are literally running through those neighborhoods, on average, those neighborhoods have a 10-point gap in proximity and a 17-point gap in labor market engagement, without transportation to connect them to that economy. And so here's just a little chart that lets you see what that actually looks like, as compared to the other of our groups in our community. When you look at income poverty rate, again, it's exponentially different among people of color in our community. Unemployment rates significantly higher again. So understanding that Savannah is nearly 53% Black, and we can see that poverty is almost an exclusive problem for Black households in our community. We can see that with the median family income, which is double on one side of the spectrum than the other. Again, that housing cost and burden, rent burden, is significant, and this is growing every day. If you think about all of the issues surrounding COVID and what that did, and our lack of long-term eviction relief in our community, and how landlords are rent hiking every day, and it's causing a significant amount of displacement. But when you think about who's being displaced first, obviously households of color have a greater burden of housing costs and cost of living because of all of the reasons that I've explained to you. And so as we talk about socioeconomic resilience and what that looks like, again, it is necessary for us to continue this conversation, to talk about national best practices like guaranteed income, like Medicaid expansion, like developing city countywide transits. And these statistics that I'm sharing would not look much different in most urban southern cities, but also if you think about rural pockets of our community and our state who don't have transportation, who don't have affordable housing, who don't have the social safety net systems and resources available in their community, and even the lack of medical support there, and supportive networks. You can imagine that these are exponential, and that they again create a barrier to socioeconomic resilience, not just for those people who are living in poverty and asset poverty, but also for those of us who are working to overcome those barriers and the disparities, because they're consistent, they're widening every day. And so I hope that one of the things that we can discuss today, or that you may have questions about, or that even spurn a conversation among yourselves and in your circles of influence, that you understand that an economy that does not work for everyone, it's not working. And so what are some of the things that we can do? We can go for big change. We can look for not only policy problems that we can work on and advocate for and insist on, but we can look across our social safety net and create programming and interventions that create bridging capital for people, for example, who live in the public benefit cliff, who earn too much to receive public benefits, but don't earn enough to create self-sufficiency for themselves. We currently have no bridging capital in our state for those folks. Georgia is literally one of the states holding out nationally to create an earned income tax credit that we saw that provided during the COVID and pandemic. We saw that people were able to bridge that public benefits gap and to use those additional dollars they were receiving for food, for school supplies, and those gas and things that the family really needed. We should prioritize our partnership and collective power. Without radical collaboration and even consolidation in some cases, we will not see this needle move. We've got to work together at every institutional, association, and individual level of our communities. We have to understand again that we are required as leaders to lead with empathy and compassion. Leadership is all about influence and the opportunity of helping other people reach their highest and best use. And if that's not fundamental in your core values as a leader, whether you're a student or a professor or working in public health, then we really shouldn't be leading. Fourth and lastly, we need to act with integrity urgently. We need to urgently act on those top three things and begin to earn the community's trust to reestablish a working economy, and to right the wrongs that were done historically. And some of those wrongs have not only been institutionalized, but they've been built upon. And so again, it's not just a moral imperative, it is a justice imperative, that we begin to move toward a model of socioeconomic resilience that gives every single child growing up in our community the opportunity to thrive and to live to their fullest potential. So I am at my time, and I hope that we can count on each of you to make the move, to step up, and to drive socioeconomic resilience, economic inclusion, and equity in our community.
So thank you very much, Ms. Johnson, for that very enlightening and give us some serious food for thought, and also to appreciate that the focus is consistent with our focus as public health persons as well. So we appreciate that. So the floor is open to, or the call is open to anyone who wants to make a comment or have a question for Ms. Johnson. As we move forward, we still have a little time left on the call.
This is Carl. Ms. Johnson, I was just curious, how does your organization align with our city and county government, and thinking about how the strategic priorities that your organization has set? And I know they kind of mirror some of the steps that have recently taken place, in particular in the city, as far as housing. But how do y'all work cooperatively? Let's hope you do work cooperatively. I hope they do. I think
yes, we as much as possible that you can work cooperatively with municipal government. We seek to do that. We have working agreements with both the city and the county. For example, we are state intermediary for public benefits. So we oversee over 10 agencies across the social safety net that help enroll people into public benefits and education. We have a workforce development program that is primarily underwritten by the county, where we are working to help those who are unemployed and underemployed get the skills that they need, not only to get soft skills, but hard skills, and remove barriers to self-sufficiency to get them rapidly attached and into working and stabilized into work. So we have financial literacy. We currently also are AmeriCorps Vista intermediaries here in our area. And what that means is that we help recruit people from all over the nation to work in agencies who are working to solution for poverty or some aspect of poverty, to increase their capacity both in funding and in human resources, in that volunteer is a full-time employee or works as a full-time person, volunteering in that organization without pay for a whole year. And so that program helps to strengthen our social safety net immensely, and then and helps us to reinvest anywhere up to $1 million back into the social safety net, just with funding and human resources.
Great, thank you.
Okay, thank you, Ms. Owens. Anyone else have a question? Comment? So I do. So Ms. Johnson, so going back to your discussion and your focus on there's the DEI, but there's the IA, which I'm just so you're familiar with. And that a lot of that is where a lot of people believe the accountability side of things really are, on that one. And I was wondering, given what the focus and the mission of Step Up Savannah is, can you speak a little bit about the not in just your particular not-for-profit, and I know that your not-for-profit works with a lot of other not-for-profits. Kind of what's the thinking these days, around the accountability side of it,
Yeah.
given the challenge of that?
Yeah, so I think accountability happens two ways, right? Not just individually, and that's where we usually end. We talk about individual accountability, but we rarely hold institutions, associations, and policy and program folks accountable in the way that we should, because we're so focused on individual accountability. But by no fault of their own, if someone moves into a neighborhood in Savannah that doesn't have adequate transit system for them to even improve their quality of life, and they don't own a car, are we saying that because they don't own a car, they should then be annexed into poverty because of where they now have to live, right? So we have not done what could have been done, right, with the long-term community investments to move people from this situation. And we even, in some cases, our county officials, city officials, state officials have over generations now, like the political will to pay for countywide transit or to put in the infrastructure. And quite frankly, when we talk about things like T-SPLOST and transportation SPLOST or the educational SPLOST, we're investing. You and I are taking our penny, that extra sales tax penny. Well, I would like to see my penny invested in those children moving out of being able to bridge themselves and create economic mobility from those neighborhoods. In fact, our great Georgia Senator, Senator Warnock, was born into one of those places, those opportunity zones, Kate and Fraser. That particular area or census tract, they're only projected to make $16,000 by the time they're 35. Well, Senator Warnock and many, no matter what your political affiliations are, has mentioned time and time again about the interventions that were necessary for him and his family members to be able to move out of those situations, whether it was, someone that put him in an extra school program that was available that we have now cut. We've, as a country, cut a lot of these programmatic interventions, or providing, some extra or additional wraparound servicing. Well, you and I both know from a public health perspective, those things are being cut everywhere, right? And public health policy hasn't really changed in decades in some of the, around some of these issues that cause exclusionary, exploitative, practice. And so we see it over and over again. And so the requirement then, if the needle's not moving, any rational group of people would have a conversation and look not just externally in that circle of accountability, right? But also internally about our policies, our programs, our paradigms, and why they are not addressing the issue.
Yeah. So I think the question for us is that, the comment for us is the observation is that, Savannah and Chatham sit in a very uniquely area that is, very progressively oriented. But despite that, you have the usual challenges that cities and counties with large populations, particularly historically, with historical populations have.
Right.
So in that context, though, what you presented it is more of a challenge to persons in general. I'm just wondering, though, given where we sit, the accountability side of it is bigger than y'all, but you all are also looked upon to be examples of how to model that, and how it should be done. And I guess that's where the question is the modeling part. How is that going? How's that working given the reality of what you see? Does that make sense as a question?
Yes, sir. So one of the things that we've done recently, again, since I've been with the organization, is to change that poverty reduction narrative, that toxic charity narrative, that, just wants to set up another food pantry or to do one-off donations or, or to focus on individual accountability versus removing systematic barriers, right? Because first we have to remove the systematic barriers to even hold individuals accountable. And so one of the things that we've worked on is changing that narrative, having the conversations like we're having today, modeling that in our programmatic interventions, ensuring that we don't see people as clients or participants, but that we're not a social service organization. What we want to do is to be able to empower people using the resources available in the community in a way that gives them access, influence, and opportunity, what I like to call AIO, right? And self-agency to be able to attach to the economy, to make a decision, and to give them the tools in their toolkit to do just that. And so as we've advanced the model, even within our own agency, we see great outcomes.
Okay, thank you.
Mhm.
All right. Anybody else? Okay, then. Well, Ms. Johnson, we really are grateful that you've taken the time out of your day and to come and talk with us, and we were always appreciative of that. And thank you for allowing us to record this, and thank you for allowing us to share your presentation. There were a number of persons who could not make it because of time constraints, and even some people who came on but had to leave early for class and things. So that's going to be really helpful, and I'm hoping they will follow up with you. And again, we appreciate it. And I want to just take a moment to thank everyone for being on. We have more of these great presentations, grand round presentation to come from both our community partners and our alumni. One of our next one is an alumni. And so we hope that you can take the time to come and join us for a little bit, and we'll follow up. So Ms. Johnson, we hope you have a good rest of the day and rest of the week. And I know I will run into you at some point, out there doing good work. So, all right then. So thanks everyone, and have a good rest of the day. And we will end the session. Okay. Thank you all.
Bye-bye.